This is the anterior labral tear test. If the patient is complaining of anterior groin pain, I would do this test to rule in if it may be a labral tear. So I'm going to start with the patient in hip flexion, abduction, and external rotation. And I'm going to move into extension, adduction, and internal rotation. I'm going to make it a swift motion. If she complains of that anterior groin pain as I'm doing this is a positive sign. I can do the same for a posterior labral tear test. So I would bring her hip into flexion, adduction, and internal rotation, move into extension, abduction, and external rotation. So I'd do that as a swift motion as well. If she complains of her symptoms, then this is a positive test. This is the flexion adduction test to test for early signs of hip dysplasia. I would do this test in children or young adults. So I'm going to have the patient put her hip and knee into some flexion, and then trying to bring this knee to the other side of her hip while stabilized down so she doesn't move that hip. She gets her knee all the way to the other side, so this would be a negative test. This is a log roll test if I suspect intra-articular hip joint pain. So I'm going to roll both legs. This is the log roll test if I suspect intra-articular hip pain. So I'm going to roll one side into max internal rotation and then roll that same leg into max external rotation. I'm going to do the same for the opposite leg. Look for symmetry. If I feel a springy block or if there's asymmetry, this is a positive test. This is the anterior impingement or fader test. I'm going to put the patient into hip flexion, adduction, and a little bit of internal rotation. If this reproduces her symptoms that she's coming in complaining of, this is a positive test. So this is the prone active straight leg test to see if there's any instability at the SI joint. So I'm going to have her lift her involved side leg second, but for this video purposes, we'll do it first. So can you lift up your leg? And if she has reproduction of her symptoms, I will have her lower her leg. I will provide compression of the SI joint and have her lift up that same leg again. If this lessens her symptoms, this is a positive test for a form closure instability issue. To test if it's a force closure instability issue, I will have her lift up her leg again and then lift up the opposite arm off the table and hold while I give resistance. If this lessens her symptoms, this is a positive test for a force closure issue causing instability at the SI joint. This is the Patrick's Faber test. I'm going to put the patient in a position of hip flexion, abduction, and external rotation. Have her place that ankle on top of the opposite knee and let that knee just fall down. I would measure the distance between her knee and the table, as well as doing the same thing to the other side, measuring that distance. If there's a distance greater than 4 centimeters, this is a positive test. I'm going to be performing the supine active straight leg raise test to test the stability of the SI joint. So for the first, I'm going to have her lift the uninvolved leg side first and then the involved side. So we'll start with the involved side for video purposes. Can you raise your leg up and tell me if you have reproduction of your symptoms? Okay, lower that. I'm going to compress the SI joint, and can you lift up your leg? If she has relief of her symptoms with my compression, that is indicative of a form closure problem. To test if it is a force closure problem, I can have her lift her leg up again and then bring this shoulder up to that leg. Can you move up? I'm going to push down. If this lessens her symptoms, this is indicative of a force closure issue. This is the hip scours test. I would do this if I suspect there to be intra-articular hip pain. So So I'm going to bring the patient's leg up to a 90 degrees of hip flexion and 90 degrees of knee flexion. I'm going to provide compression down into the joint and slowly rotate through multiple motions. If the patient complains of pain throughout these multiple motions, this is a positive test, and she's likely to have intra-articular issues. This is the patellopubic percussion test to screen for a potential fracture in the hip or the femur. I'm going to have the patient slide her hand down her front and feel for that pubic bone. I'm going to place this right on that spot, have her hold it there. Then I'm going to tap on the kneecap. And I'm going to compare the other side as well. For this test to be positive, I would have to hear a muffled sound on either the left or right. This would indicate that there is a fracture within that area. This is a lateral glide of the hip for a joint mobilization. I'm going to have the patient in this position with the towel placed in her inner thigh for comfort. I could also pick her leg up into a 90-90 position. So I'm going to apply my force posteriorly with my hips to get that lateral distraction. If I want to add motion to it, I can keep that posterior force with some hip flexion and extension. I could do a grade 1 or 2 for pain, or a grade 3 or 4 for stiffness. This is a PA joint mobilization for the hip. So I'm going to slip the joint belt underneath the patient's knee. All right. So I can have the patient's knee just lifted off the top like this, making sure the hip is in alignment, no ab or adduction. Then I'm going to find the femoral head and then apply my PA glides downward. And I can do a 1 or 2 for pain, or a 3 and 4 for stiffness. This is a long axis distraction joint mobilization for the hip. So I'll have the patient in supine. I'm going to grab my joint mobilization belt, do a little figure 8 with it, slide the patient's foot into the belt, grab my hands proximal to the ankle, and then I'm going to lean back and pull that femur out. And you can do grade 1 for pain, grade 1 or 2 for pain, or grade 3 or 4 for stiffness. So I'm going to do an AP glide of the hip for a joint mobilization. I'm going to have the patient in a position like so. I'm going to slide my joint belt underneath her thigh, lifting up so that hip is in relative flexion. Then I'm going to find the femoral head and apply my AP glide. I could do grade 1s or 2 for pain, or 3 and 4 for stiffness. This is the fulcrum test to test for a stress fracture. So I'm going to take my forearm and place it underneath the affected leg, and then I'm going to press down towards the ground. If the patient complains of the symptoms that she was having, this is a positive test for a stress fracture. This is the external derotation test, where it tests for gluteus medius and minimus pathology. So I'm going to have the patient get into a 90-90 hip flexion and knee flexion position. I'm going to externally rotate her hip, and then I'm going to place my hand at the ankle and have her push against me back to the neutral 90-90 position. All right, if she has a reproduction of her complaints of symptoms, this is a positive test. This is the Eli's test to test for rectus femoris tightness. So I'm going to have the patient lying prone. I'm going to lift up her knee, bend it until I see that hip pop up, If the hip pops up, this is a positive test for rectus femoris tightness. This is the correct test to test the alignment of the hip. So first I'm going to palpate for the greater trochanter by internally and externally rotating the femur. And once I feel where that greater trochanter is at its maximal protrusion, I'm going to keep her leg there. I'm going to take my goniometer and do a measurement. All right. If it is less than 8 degrees, then that is femoral retroversion. If it is more than 15 degrees, then it is anteversion. She was at 10 degrees, so since she is at 10 degrees, she is to be considered normal. This is the Trendelenburg test to test for gluteal pathology. So I'm going to have her single leg stance on one leg for about 30 seconds. If she has trouble with balancing, she can place 2 fingers onto the mat. I'm looking for that contralateral drop of the pelvis as well as her complaint of symptoms, and that would indicate a positive test. This is the piriformis test to test for piriformis tightness to see if it's causing sciatic pain. So I'm going to have the patient inside lying. I'm going to bend her hip at around 60 degrees and the knee around 90 degrees. Then I'm going to have her put her leg into a motion of external rotation and abduction against my resistance. Can you do that? All right, relax. If this elicits her symptoms that she's been complaining of or that sciatic pain, then this is a positive test.